Starting. All attendees are in listen-only mode.
Good morning, everybody. This is Stacy Jones, DDA's Statewide Employment Services Coordinator. Thank you, everyone, for joining us for our monthly Employment First webinar. As always, before we move on to our content, I just want to run through really quickly some housekeeping items related to the webinar so that everyone can get situated. As a reminder, all of our participants are in listen-only mode. There are two options for listening to the webinar. You can connect via your computer or via the telephone. If during the webinar you're having trouble hearing, you might want to try switching by clicking on the appropriate button on the webinar panel, which you'll see on the right side of your screen. Now, if you happen to be connected via both your computer and your phone, make sure you turn down the sound on your computer so that you don't get feedback. There are two handouts for this webinar that are available to you right now. Again, if you look on the right-hand side of your screen control panel, towards the bottom, you'll see a little toggle that says handouts, and you are able to actually download both of those handouts. However, if for some reason you have trouble downloading, don't worry, because both of the handouts will be emailed to all participants that registered for today's webinar. As with all of our webinars, this one is being recorded and will be available on DDA's website on our archived webinar page within the next few weeks. Questions can be typed in the question box on the right-hand side, but as we get started, I'm going to give some other instructions related to questions, so more information on that. So now that our housekeeping is out of the way, we are happy today to be highlighting the DDA's collaboration with our state partners in employment services, the Division of Rehabilitation Services, or DORS. This webinar will be providing a higher level overview of some of the specific collaboration efforts thus far and more to come. I would first like to introduce to you Bernie Simons, the Deputy Secretary of the Developmental Disabilities Administration, and he's going to be providing us with a few opening comments. Bernie?
So good morning, and thank you for participating in today's webinar. I'd like to turn the clock back a little bit to 2016, and some of you may or may not know this, but the Institute for Community Inclusion at UMass Boston is who we do a lot of work with the Supported Employment Leadership Network, as well as the NASD is another association. And in 2016, they conducted an analysis looking at state employment characteristic systems. And they looked at DDA, and they looked at DORS, and they looked at the state public education system, obviously MSTE, and the special ed and early intervention system. And they looked at the relationship and came up with some composite indicators. And for those of you who may not know this, Maryland had the highest overall score in the nation, and actually they started to do research around the collaboration we have with DORS and with MSTE. But you know, where we are today, we're talking about DORS, and actually they have done webinars on the state of Maryland since then, showing us as a national model. So having said that as the backdrop with our relationship, and again, we're going back to 2016, and we had a relationship prior to that, but I think as we continue to evolve and mature, I think today's a good way to show that we have still a very strong commitment as we move forward with our partnership on collaboration and relationship building with DORS at a state level and also at a local level with your local offices for DORS and our local regional offices. So with that, those are my opening remarks, and I'd like to turn this over to Scott Dennis, and thank you.
Good morning, everyone. I'd like to welcome everybody to this webinar. I'd like to first start off by thanking Bernie and his team, Stacy, for this collaborative effort that has been undertaken with the development of this new MOU. It's been a joint effort led by Stacy from DDA and Jill Pierce from the Division of Rehabilitation Services. And I think it's a collaborative effort that I think as you go through this webinar, you'll see the emphasis on this collaboration. No single agency has the necessary resources to provide all the services that an individual might need to be able to go back to work. Thus, it's the importance of working in concert with each other for the overall benefit of our mutual customers. By doing this, it allows an individual the opportunity to work in their community, and I think this is a great first step in these trainings. As they go through the MOU, you'll see there will be a number of joint trainings that will be put on by both DDA and DORS for this efforts. So I want to thank you very much, and we look forward to working with everybody in the future. Thank you.
Thank you, Scott, and thank you, Bernie. I appreciate those comments. And in just 1 second, I'm going to include Jill here, but before I make that introduction, I just want to say that today's webinar is not meant to provide in-depth guidance or serve as a training necessarily. We'll talk about this as we go forward, but DORS and DDA are working on creating really robust guidance documents about our collaboration, including frequently asked questions documents that we'll talk about. So we're asking that if questions arise in your mind as you listen to us speak about our collaboration, anything related to DORS and DDA employment services, especially where those two things intersect, we would really like you to forward those questions to us so that we can use those when developing our training materials. And we'll tell you how to do that towards the end of the presentation. So it's my great pleasure to introduce my co-presenter this morning, Jill Pierce. She is the Staff Specialist for Transition and Supported Employment with DORS. Jill, welcome.
Thank you, Stacy.
And before I pass things off to the next slide, we want to do a couple of quick poll questions because Jill and I would like to know what the makeup of our audience is in relation to DORS and DDA. So if you'll bear with me 1 second, I have a couple of poll questions really quick, and these are 3 yes or no questions. The first one is, do you currently provide DDA funded employment services? So you're going to say yes or no. And if it doesn't pertain to you, don't worry, you can just put no. And give a few more seconds there. So again, do you currently provide DDA-funded employment services? Give 5 more seconds. Okay, I'm going to close that poll. Looks like we have 67% of people on the webinar say yes, 33% say no. All right, second question. Do you currently provide DORS-funded employment services? Same thing, yes or no? Okay, a few more seconds. Do you currently provide DORS-funded employment services? Okay, we're at 62% say yes and 38% say no. And then the final question, do you provide both DDA and DORS-funded employment services? We're almost at half and half. Again, do you provide both DDA and DORS-funded employment services? Okay, looks like we're about 55% yes, 45% no. Okay, so that gives us just a better, and for those of you that are on the call that say, well, none of those pertain to me, well, don't worry, we care about you too, and we're happy that you're here. We just wanted to know kind of the makeup of providers and who's accessing which funding. So Jill, I'm gonna progress to the next slide here and let you get things started for us.
Okay. So looking at the history between DORS and DDA, we have a long history of working together as both agencies often serve some of the same individuals. And to outline how we work together, DORS and DDA maintain a memorandum of understanding, which was most recently updated this year. So the updates became effective on June 21st, 2018. And just as an FYI, the full memorandum of understanding is available to the public. It is on the DDA website and available on DORS as well for DORS internal staff. So the last memorandum of understanding between DORS and DDA was signed back in 2013. And although it was only 5 years ago, a lot has changed on both the DORS and the DDA end. So both agencies have made a commitment to review it annually to ensure that it maintains relevancy to all federal guidance and any new local initiatives. And in the past couple of years, there hasn't been as much ongoing technical assistance or collaboration that we would have liked, but collaboration has been happening in some areas, in some more than others, and we'd like that to be expanded over the state. The MOU emphasizes this ongoing collaboration at the state and the local level. And it also promotes ongoing conversations, state and local level again, between DORS, providers, DDA, and CCSs. The federal context has also changed over time. DDA has made changes related to rules issued by the Center for Medicare and Medicaid, and DORS has had significant changes and new responsibilities based off of the federal passing of the Workforce Innovation Opportunity Act, which I'll go into in a little further detail in the next slide over. Okay. All right, so let's talk about that legislation that impacted this MOU. As we definitely had to take into account these changes when updating the MOU. And if you've spoken to anybody from DORS within the past 3 years, then you've surely heard of the Workforce Innovation Opportunity Act. So this is a federal legislation that dramatically changed the way vocational rehabilitation agencies statewide operate. So not just in Maryland, this is a statewide impact. This legislation was signed into law in 2014, but most aspects of it didn't take effect until July 2015. And the final regulations weren't released until August of 2016. So the legislation is still fairly recent, but it does impact the way DORS collaborates with our partners. It also fosters regional collaboration as well as adds new requirements for all vocational rehabilitation agencies to provide by. So again, this is not just DORS, this is nationwide. So DORS is now required to set aside 15% of our federal funds to provide pre-employment transition services to students with disabilities who are both eligible for DORS or potentially eligible for DORS. And when I say set aside, I'm referring to 15% of the money DORS currently receives. So this does not mean, unfortunately, that we have an increase in federal funding. And I'm not going to focus on the details of pre-employment transition services during this webinar, but DORS does have additional information about it on our website, and you are always welcome to contact me if you have any questions or comments. Okay, so the Workforce Innovation Opportunity Act also enables for increased access to DORS-funded supported employment services. So DORS is now able to serve individuals that require supported employment services through natural supports if they don't have a source of long-term funding. It also increases access to supported employment services for youth that may or may not have had that access. And DORS just completed regional trainings regarding our updated policies on supported employment services. And if you'd like more details on the specifics of these changes, feel free to visit our website. We house all of our full policies and support documents on there as well. So you are welcome to read our supported employment policy for a little light reading. And I'm going to pass it back to Stacy, who's going to discuss DDA's transformation in response to new rules.
Thanks, Jill. I like that you called that light reading. I'm not sure anybody else would agree with that. So along with WIOA, some other federal context that helps inform DDA and DORS collaboration is around the Centers for Medicare and Medicaid, or CMS's final rule. And I think at this point, most people have a working knowledge of that rule, but basically it reflects CMS's intent that individuals receiving services and supports through home and community-based service programs have full access to the benefits of community living. And that absolutely includes competitive employment, and being able to receive those services in the most integrated setting. So all states and all settings must meet that final rule by March of 2022. So with this higher emphasis on community settings and specifically competitive employment, DDA provider agencies over the last several years have really been focusing their services and supports on how to support people on their path to employment. And that includes people that may have in the past not seen employment as a desired outcome, or haven't explored those outcomes, but maybe are at this point. And something I didn't include in this slide, which is absolutely relevant to this conversation as well, is Maryland's 2016 legislation through the Ken Capone Equal Employment Act, which requires the phase out of subminimum wage work through the use of Department of Labor 14C certificates by the end of September 2020. So both the CMS final rule and CMS's guidance around employment that they have put out, as well as the 14C phase out, just puts more emphasis on competitive employment as a preferred outcome for people receiving services. So this makes our DDA and our DORS partnership even more critical as students and adults and families and providers and CCSs, schools, whoever our partners are, as they all navigate what are the available resources to support those outcomes. And we realize, I don't think it's a shock to anybody, that these are complex systems. And so we know that moving forward, we really need to make them more accessible and understandable. Jill?
Okay. So with all these changes that Stacy and I both mentioned that impacted both DORS and DDA, it just made sense at this time to update our MOU and really figure out a way that our agencies can best work together under our current state structures and all our upcoming changes. So this task was not taken lightly by either agency, and it was about a year-long process. So it's been in the works for a while. DORS and DDA leadership spent time meeting with mutual providers about what's been working, what hasn't been working, through their experiences of accessing both systems or not accessing both systems, and maybe why they didn't access both systems. These meetings were really valuable. They were so valuable that we've discussed continuing them to continue to work to eliminate any of the gaps in our collaborative systems. There were also quarterly leadership meetings between DORS and DDA, which was also deemed valuable to maintain an ongoing collaborative relationship. So this quarterly meeting will continue to assist both agencies in continuing to work together to best meet the needs of mutual individuals. And there was also ongoing communication between DORS and DDA specialists, this meaning that Stacy and I talk all the time. And we also consult with each other when we receive questions from the field. So just know that this, we have the commitment to continue this as well, so that when the field is asking either of us a question, that we are committed to both of our agencies effectively working together. And we hope that this is also mirrored in the field. And DORS and DDA leadership also took local input, questions, and concerns into account when updating this MOU. So this collaborative process to update the MOU, and collaboration is emphasized in there throughout, as well as expected that all parties supporting individuals with developmental disabilities are actively communicating when they're serving mutual individuals or potentially mutual individuals. But through this process, there were also a lot of gaps that were identified. So I'll let Stacy go into detail about some of these gaps.
Thanks, Jill. So as Jill mentioned, we had a lot of opportunities to gain at least preliminary stakeholder feedback, and we did come up with some basic themes that were identified over and over again related to our current systems, our current collaboration, and everything that goes along with that. So this comes as no shock, but people identified over and over just the general complexity when trying to navigate both systems. And something that adds to that complexity is the fact that both DDA and DORS have differing funding mechanisms and requirement differences. So when trying to braid funding, this can be intimidating if you maybe only have a working knowledge of one system but not the other, and so that can be a barrier. And also, to add on to that complexity, the fact that DDA is undergoing a transformation in and of itself and shifting our internal systems and processes and service definitions around employment. So there's a lot happening that leads to the complexity. Probably one of the most cited barriers that I heard specifically from DDA providers who were shared that they were often reluctant to access DORS funding for fear that they would be, it would be considered double dipping funds in an inappropriate manner. And some of those providers, because of that fear, maybe had made a decision to not access DORS funding so that they could avoid that potential conflict. So one thing that we identified as a need moving forward is to help provide guidance around that particular issue. We also heard from some providers, some DDA providers that maybe in the past have provided DORS services years ago, but maybe they stopped for a variety of reasons and just never got hooked back up again at their local office. And they've been reluctant to do that because maybe they're unsure about how to get started. Maybe they're unaware of some of the new programs that Jill mentioned, and more specifically, the pre-employment transition services. So really just re-educating what some of the availability or some of the available service options. And we heard over and over again about capacity issues all around, whether it's capacity issues at a particular provider agency, maybe just lacking staff to provide a particular employment service that might be needed, or maybe capacity at a local DORS office. It could be capacity among a CCS that maybe isn't aware of all the particular services that are available. So we know that that's an issue that we need to address as well. Again, we heard that relationships that hadn't existed at local regional offices or did or didn't exist made all the difference in how well people and families and CCSs and providers, school systems were able to navigate all of those systems. So in areas where relationships are being identified as strong and well developed, things tend to work a little better. In areas where there are no relationships, where it's been harder to build a relationship because of capacity issues or other issues, things don't work as smoothly, and then that makes everyone, pardon me, reluctant. Sorry, I had to cough. So we want to work on closing those gaps. We identified another major gap that in general, there, as Jill already alluded to, there's no real collaboration or joint guidance that's been produced recently and put forth in a formal way from DDA and DORS. So this can make things difficult when things aren't working, especially when you get down to a more local level. Sometimes no one's quite sure of how to move forward if there's a question. So we want to provide those avenues for questions and technical assistance. And finally, just general confusion related to who pays for what and when. Those are common questions. And obviously, I'm quite sure that this list is not definitive, but I think it represents the general themes that emerged over time. And I also want to just throw in there, I don't have a bullet related to this, but you know, Bernie alluded to this in the beginning, that these collaborations aren't just always touching DORS and DDA. We certainly have other state partners that are actually very important in these collaborations as well, even though this particular webinar focuses on DDA and DORS, but we certainly have other state level partners, MSDE, local school systems, transition councils, Dollar, Department of Disability, certainly our CCSs, DDA regional offices. We know that these are complex partnerships, and we want to keep those conversations going. So I'm going to pass things off to Jill again, and she's going to highlight a few of the items that you'll see in the MOU when you read it.
Yeah, and you are welcome to spend your Friday night tonight reading the MOU in full, but in case that's not your plan, I'll just go through a couple of the highlights. But okay, so the MOU reflects new language that is defined in WIOA, and some examples of that new language include pre-employment transition services and competitive integrated employment. So if you are referring to the MOU during the webinar, just take a look at the glossary of terms, and it is pretty hefty, but we wanted to make sure we encompass the very specific new definitions in there. So competitive integrated employment, it's been identified as the desired outcomes when employment services are provided by either DORS and or DDA. We've always been focused on competitive employment, but competitive integrated employment now requires that the employment has competitive wages, it's in an integrated setting, and there are opportunities for advancement. Ongoing collaboration and technical assistance, that is also noted throughout the MOU, and with the consent of the individual, if both DDA and DORS are serving an individual, they should be sharing information with each other. So they meaning the provider, if it's a DORS and DDA provider, sharing information with the DORS field staff sharing information with the provider, CCSs, all the partners that are involved. Both individual and joint responsibilities are also documented for both DORS and DDA in the MOU. And to highlight two of the DORS responsibilities that have been noted, so DORS is required to make pre-employment transition services available to all students with disabilities as defined by WIOA. And again, if you're in that glossary of terms, that is a very specific term when we're referring to students with disabilities. And so this means that most youth that are coming to provider organizations should have had the opportunity to participate in services and have a better understanding of work. And a lot of them will have possible work experiences. So it's also DORS' responsibility to develop an individualized plan for employment with eligible individuals that are not on our waiting list. So this plan for employment will document all the services that DORS is looking to provide this individual to support them in their employment goal. The plan is developed collaboratively with the individual, and it may outline services such as career assessment services, assistive technology assessments, and intensive job development and coaching. Now that's just an example of some of the services. This plan is developed with a specific employment goal in mind, as well as the number of hours that the individual is seeking to work each week. So we really want to be cognizant of the individual's preference. Are they looking for 20 hours a week, 30 hours a week? And that will be represented in the plan for employment. And if the individual consents to share the document, it's really important that DORS, the CCS, and the provider all have a copy of the same document so we know what the individual's plan for employment is. And I'll let Stacy, if you want to highlight some of DDA's responsibilities that are listed in the MOU as well.
Sure, thank you. So some DDA responsibilities, the first one really DDA, through the coordinators of community services or CCSs, will facilitate the development of a person-centered plan that's updated at least annually. And that person-centered plan includes information related to competitive employment goals, as well as the identification of any barriers to employment. So that's a newer component of DDA person-centered plans. And that same person-centered plan is designed to address barriers to employment as expressed by the individual. So if there's something that that the person or the team feels is keeping the person from becoming employed, and the person wants to be employed, then the plan is really a great way to outline what needs to happen next. And also, DDA and/or CCS will consider providing a referral to DORS if a person is not employed but expresses interest in competitive integrated employment. And actually, when I was mentioning gaps a few slides ago, this was a big one that was noted. When is the right time to refer a person to DORS services? Because what the feedback that we would get is if the person was referred too early in the process, it might mean that the person used up hours before the person actually was ready for competitive integrated employment. However, if it happened too late, then the approved hours may not be available when they're needed. So we identified that this is a really big area, is helping providers have a better understanding of the timing of getting the referrals just right. And some of that, again, goes back to, or could potentially go back to, capacity issues and particular timing issues of a regional office. So that's another area. And one more role is, just as Jill said, if a person's receiving DDA and DORS services, every effort will be made to collaborate those efforts to improve those employment outcomes. So this means attending as many joint meetings as possible for the person that's on their path to competitive integrated employment, and when appropriate, to share information. So if DORS is part of that partnership at the local level, then they need to be included from pretty early on so that they know what's happening and they know the timing and those things. Whoops. Okay, so the next slide talks about accessing DDA and DORS funding. So a person receiving DDA services, of course, depends on eligibility and whether the person's been approved to start services. And so for the purposes of this slide, we're assuming a person is eligible. They've applied, they've been approved for DDA services, they've been approved for a Medicaid waiver. And again, the person-centered plan facilitated by the person and their CCS and team will identify what the person's identified outcomes are. So if a person has identified employment as a potential outcome, then the team can help the person navigate what services and supports would be the most beneficial as a next step. And of course, this is going to be individualized based on the person's history, their skills, their abilities, their circumstances. So for instance, if we're talking about a person that is that's been in DDA services for some time, that maybe has no past work history, no real community-based work exploration experience, no volunteer experience, the person isn't really sure of what they're interested in, not sure of their skills or abilities outside of maybe what was, maybe what happened in a more segregated setting. A potential first step could be to do some exploration through a DDA-funded service, whether those type of activities could happen through DayHab, community development services, supported employment, employment discovery and customization. And then of course, after July 1st of 2019, DDA will be adding new employment service called Discovery that could be an appropriate service for that person. So that's just one scenario. Another scenario could be that the person you're supporting has those experiences that I talked about, and maybe has worked before and needs supports to work again right now. And maybe now's the appropriate time to access DORS because the person doesn't need any more exploration. So it's a very individualized approach. And I'm going to ask Jill to talk about when does an individual access DORS?
Okay. Yeah, so when does an individual access DORS? And when I say access DORS services, I am referring to our adult vocational rehabilitation services, not our pre-employment transition services, as it's pretty cut and dry for pre-employment transition services. That's specifically students with disabilities. But so for DORS services beyond pre-employment transition services, an individual can access DORS services when they are interested in seeking competitive integrated employment, apply, are found eligible, and are not on the wait list. And I just want to make that distinction because just because someone's referred doesn't always necessarily mean that they are going to end up accessing DORS services at that time. So this doesn't mean that every individual who says, says the word work or nods when they're asked if they would like to work should automatically be referred to DORS. We really want to make sure that everyone knows how to maximize available resources and use them in the most effective way possible. So DORS services are most effective when an individual has expressed current, so not in a couple years, but really a current interest in competitive integrated employment. They understand what work is, and they have a community rehabilitation provider with a basic understanding of their interests, their skills, their ability. So they've done some sort of exploration around work. And providers, if you're ever not sure if referring someone for DORS services is really appropriate at that time, just talk to your local DORS partners and see what they think, problem solve. Sometimes it's not a cut and dry answer, but really having that relationship and that communication will be able to help you make that individualized decision for each individual.
And our last bullet here is it possible for an individual to access both DDA and DORS services? And the answer is yes, as long as the person is not receiving services that occur at the same time. So a person can receive DDA funds and services on the same day that they receive DORS funded services, as long as the services don't happen at the same time. So I'm going to give you an example. A person could receive DORS funded job development services between 9 a.m. and 11 a.m. and DDA funded rehabilitation services from 11 a.m. to 3 p.m. And this is possible because there is currently only a 4-hour minimum attendance in order to bill for a full day of DDA rehabilitation services. So currently, the DDA system only allows for one DDA employment or day service to happen on the same day. So for instance, a person can either be receiving rehabilitation or supported employment, but not both on the same day. But we're happy to say that the ability to receive more than one DDA employment service in a given day is going to change July 1st of 2019 when we have an hourly billing system in place. So while I agree there's some complexities in our current system to figure out how to access both services on the same day, it can happen as long as the hour of service doesn't overlap and they're separated. And we can certainly provide more guidance for providers that are struggling with figuring that piece out. And I just, there was a question in the question box that I wanted to address. Randy asked when discovery services through DDA are available. Again, that's a new waiver service that was approved under our new waiver that's set to start July 1st of 2019. And for anybody that didn't get a chance to listen or watch the webinar I did last month, I did a pretty thorough walkthrough of our services. So if you still have questions about that, you can ask. But having said that, we currently do have a service called Employment Discovery and Customization through DDA, and people can access that today. But that still is a daily, a service based on a daily rate. Jill, you want to talk about some next steps?
Sure. So next steps, we do have regional trainings that are up and coming, and that will be on, the details of those will be on the following slides. But Employment First emails were sent out inviting everybody to register for these in-person meetings. So if you have not registered and you're interested in attending, please do so that we can just make sure we have the space and availability and are ready for everybody. If you did miss the email or the link, Stacy, I think a slide right before we close out, Stacy will be directing you to the registration link, which is on the DD website. And we will be, if for some reason you can't attend any of the in-person ones, it is 4, so they're across the state to try and give access to everybody. We will be looking at recording one of them so that everybody will have access to it. So another next step, DDA DORS quarterly leadership meetings. And I think this is something I alluded to early on in this webinar, but when DDA and DORS were in the process of updating the MOU, part of that process was leadership meeting on a quarterly basis. And that's something that both agencies have committed to continue doing to make sure that we stay on the same page and we really continue our ongoing collaboration with each other. So that will continue to happen. Another next step, joint provider regional focus groups, late 2018, early 2019. And again, that was something mentioned early on, that in the process of developing updating the MOU, we did have provider regional focus groups, and we, both DORS and DDA received a lot of good information from providers that are out in the field, either accessing one system or both systems, or attempting to access systems, just as far as what was really working on the field level and what wasn't. And that process helped us identify a lot of the gaps in our collaborative systems. So we are going to look at continuing that so that we, both agencies can really work as a team to continue identifying gaps if we missed any, and really eliminating those gaps so that both agencies better work together. And finally, both agencies are committed to reviewing the MOU annually or as needed. And definitely with, DORS has been having significant changes, and DDA's transformation is currently happening. As Stacy noted, there'll be additional changes next year that will come to fruition. So we will take a look back at the MOU just to make sure it is still relevant and it still accurately depicts how we're able to work together under both of our system structures. So that will be ongoing. And then if you want to go to the next slide, Stacy, we do have a list out of all the physical locations and times of the training. So we have one in the western region of Maryland, the southern region. We also have one in the central and the eastern shore. So I believe people have begun signing up.
I'm gonna just leave this one up for just a second, just to make sure if people are writing stuff down that they can note it, and then I'll shift to the next slide, which has the next two. So the western region training is happening Tuesday, August 28th. The southern region, Wednesday, August 29th. And then we've got Central, which is Tuesday, September 4th. And then finally on the Eastern Shore, Wednesday, September 5th. All 4 sessions will be happening from 9:30 to noon, and really will be a great opportunity, again, for anybody interested, any partners, pardon me, including DDA providers, DDA staff, DORS providers, DORS staff, MSDE staff, transition coordinators, school staff, state agency partners, CCSs, or just anybody that cares about any of this, is the more the merrier. And those regional trainings will really allow us to do a much deeper dive into the MOU and really be talking about the roles and responsibilities and highlighting some of the things that we talked about here. So if you haven't received an email notice about these trainings, and so you're wondering how to register, I'm going to point out to you, if you go to DDA's website, which is listed on this page, dda.health.maryland.gov. And if you look on the right-hand side there, you'll see a screenshot of the DDA website. And on the left, it says services we provide. And towards the bottom, you'll see a link that says training and webinars. And when you click there, you will see the DDA training calendar. And for those of you that are not familiar with the training calendar, if you go on the appropriate date, you'll see a link for the training. You can just click on it and get yourself registered. And we would just ask that you please do register, because it helps us have the appropriate number of materials ready, and it also makes sure that our venue has appropriate space. So if we were to get to maximum for the venue, we would know that ahead of time. So please do register. Every person that intends to come, please register. Now, the last slide we have here is just our contact information, so mine and Jill's email addresses. And as I mentioned in the beginning, we know that you guys have really good questions, things that aren't working, things that you don't understand about the collaboration or how systems work. And we welcome those questions because, again, they do help us find the path forward as far as trainings and guidance documents. So if you have questions after hearing this webinar or headed into our trainings, we would ask that you email us and that you include both of us on the emails, because this helps as we answer questions. And please, it's very helpful when you're drafting your email to just in the subject line include DDA DORS collaboration. This will just help us with tracking and make sure that we don't lose track of anything that's lost in the shuffle, because can sometimes happen. So I'm going to just take a look. It doesn't look like we have any questions at this time. I'm going to make sure before I say that we do not have any other questions. Jill, do you have any final thoughts to add before we end?
I think you pretty much covered it, but just beyond these upcoming trainings, I know for these upcoming trainings or the webinar, if you do have questions, just to include both of us in the email. But even beyond that, if you were going to reach out to me for a DORS question that's also related to DDA, feel free to include Stacy. And if you're reaching out to Stacy that would also involve DORS, include myself on the email as well, because we communicate to make sure we can get the information to you from both perspectives as well.
Great. Okay, well, we appreciate everybody listening in. We're excited for our next steps and our ongoing collaboration. We hope to see all of you at one of our 4 regional trainings so that we can have more chance to have some dialogue and questions and answers and really get things moving forward. So again, send us your questions. And on that note, we will end things for today. Thank you, everybody, and have a wonderful weekend.